Good evening. This is All India Radio. I am Lalema Aneja Dang, and with me is R.S. Raghu with the evening news. The headlines. PM CARES Fund accords sanction for procurement of 150,000 units of Oxycare systems developed by DRDO at a cost of over 322 crore rupees. Union Cabinet approves production-linked incentive scheme for advanced chemistry cell battery storage with an outlay of 18,100 crore rupees. Government says swift clearance and apportioning of global aid by centres strengthen tertiary medical care across states and union territories for COVID management. Union Health Minister holds meeting with health ministers of 7 states and 1 union territory to review progress of COVID-19 vaccination drive. India continues to register declining trends in number of active COVID cases. Recovery rate improves to 83.04%. Over 17 crore 52 lakh doses of COVID vaccine administered in the country so far. Central Board of Direct Taxes issues refunds of over 17,061 crore rupees to more than 13 lakh taxpayers between the 1st of April to 10th of May this year. Government says nearly 34,57,000 farmers benefited from the ongoing Rabi marketing season procurement operations with MSP value of over 67,499 crore rupees. Israel-Palestine conflict escalates, death toll rises to over 50, including 1 Indian. And Indian Met Department says cyclonic storm expected in the Arabian Sea on the 16th of May. As the number of COVID cases is on the rise, we appeal to all our listeners to take precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons between the age of 18 and 44 years has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. The PM CARES Fund has accorded sanction for procurement of 150,000 units of Oxycare system developed by Defence Research and Development Organisation DRDO at a cost of over 322 crore rupees. Oxycare is an SpO2-based oxygen supply system which regulates the oxygen being administered to patients based on the sensed SpO2 levels. Under this sanction, 1 lakh manual and 50,000 automatic Oxycare systems along with non-rebreather masks are being procured. The automatic system also provides suitable audio warning for various failure scenarios including low SpO2 values and probe disconnections. The non-rebreather masks are integrated with the Oxycare systems for efficient use of oxygen which results in saving of oxygen by 30 to 40%. The non-rebreather masks need to be changed for every patient. These Oxycare systems can be used at homes, quarantine centers, COVID care centers and hospitals. DRDO has transferred the technology to multiple industries in India which will be producing the Oxycare systems.
The Union Cabinet today approved production-linked incentive scheme for the advanced chemistry cell ACC battery storage with an outlay of 18,100 crore rupees. Briefing media in New Delhi after the cabinet meeting, Information and Broadcasting Minister Prakash Javadekar said the move aims to achieve manufacturing capacity of 50 gigawatt-hour of ACC and 5 gigawatt-hour of niche ACC with an outlay of 18,100 crore rupees. He said the production-linked incentives will reduce import dependence of fuel and encourage domestic production of battery storage equipment. Mr. Javadekar said it will also give a big push to electric mobility, benefiting 3-wheeler, 4-wheeler and heavy vehicles. He said India is currently importing battery storage equipments worth 20,000 crore rupees and the scheme will be helpful in making the country self-reliant or Atmanirbhar.
देश को आत्मनिर्भर बनाने में और मेक इन इंडिया साकार करने की दृष्टि से एक बहुत महत्वपूर्ण निर्णय हुआ जिसे बैटरी स्टोरेज कहते हैं, एडवांस केमिस्ट्री सेल। बैटरी स्टोरेज का महत्व कितना है और उसके कारण कितनी चीजें आज अटकी है। तो बैटरी स्टोरेज बढ़े। आज 20,000 करोड़ का बैटरी स्टोरेज इक्विपमेंट हम आयात करते हैं। अब हम आज के जो नया प्रोडक्शन लिंक इंसेंटिव घोषित किया है PLI, उसके कारण ये इम्पोर्ट तो धीरे धीरे कम होगा ही। भारत में जो उत्पादन नहीं हो रहा है वो होना शुरू होगा। इससे इलेक्ट्रिकल व्हीकल्स, इलेक्ट्रिकल मोबिलिटी को बहुत बढ़ावा मिलेगा।
The Union Cabinet has approved signing of Memorandum of Understanding between Institute of Chartered Accountants of India ICAI and Qatar Financial Central Authority QFCA. The MOU will enhance cooperation between the institutes to work together to strengthen the accounting profession and entrepreneurship base in Qatar.
The Union Cabinet today gave its approval to the transfer of land of Indo-Tibetan Border Police ITBP to the government of Uttarakhand for development of aerial passenger ropeway system between Dehradun and Mussoorie. The Union Health Ministry has said that swift clearance and apportioning of global aid by the centre has strengthened tertiary medical care across states and union territories for COVID management. The ministry in a statement said that various ministries are collaborating through a streamlined and systematic mechanism under the whole of government approach for expeditiously delivering the incoming global aid from different countries. So far, 9,284 oxygen concentrators, 7,033 oxygen cylinders, 19 oxygen generation plants, 5,933 ventilators and bi-level positive airway pressure BiPAP machines and 3,44,000 remdesivir vials have been delivered. The global community has been helping India through international donations and aid of COVID-19 relief medical supplies and equipment since the 27th of April to support India to address the challenges of COVID management.
The Indian Air Force and the Indian Navy have continued to work round the clock to provide oxygen and other medical supplies to the civil administration to tackle the current COVID-19 situation in the country. As on today, the Indian Air Force aircraft have airlifted 403 oxygen containers of 6,856 tons capacity along with other equipment of 163 tons capacity in 634 sorties from different parts of the country. The cities covered are Jamnagar, Bhopal, Chandigarh, Panagarh, Indore, Ranchi, Agra, Jodhpur, Begumpet, Bhubaneswar, Pune, Surat, Raipur, Udaipur, Mumbai, Lucknow, Nagpur, Gwalior, Vijayawada, Baroda, Dimapur and Hindor. The Indian Air Force aircraft have also conducted 98 sorties from different countries, airlifting 95 containers of 793 tons capacity and other equipment of 204 tons capacity. The equipment has been procured from Singapore, Dubai, Thailand, Germany, Australia, Belgium, Indonesia, the Netherlands, United Kingdom, Israel and France. As part of Operation Samudra Setu 2, 7 Indian naval ships have returned home with 260 tons of liquid medical oxygen for direct supply to various states, 8 oxygen containers of total capacity 160 tons, around 2,600 oxygen-filled cylinders and 3,150 empty cylinders for oxygen from Persian Gulf and Southeast Asia. The Indian Railways has delivered nearly 6,260 tons of liquid medical oxygen to various states across the country. The Ministry of Railways said 100 oxygen expresses have completed their journey so far and brought relief to various states. The ministry said Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states across the country. Oxygen Expresses delivered nearly 800 tons of liquid medical oxygen across the country yesterday. The ministry said the first Oxygen Express to Uttarakhand had reached last night with 120 tons of oxygen from Tatanagar in Jharkhand.
Ministry of Steel has said that a total of 4,686 tons of life-saving liquid medical oxygen, LMO, has been supplied by steel plants so far. The ministry said steel fraternity stands united in the service of nation in this time of crisis. The total production of liquid medical oxygen in the country has risen to almost 9,500 tons per day, showing the capacity utilization of about 130% of the installed capacity. It said steel plants are contributing nearly half on the national production of LMO. Amid the COVID-19 pandemic, the government is continuously engaged in supply of oxygen, medical equipment and medicines in the country. In an exclusive interview with AIR News, the convener of Empowered Group 2 of Secretaries, Giridhar Aramane, said,
"We have identified, with the help of the expert panel and under the guidance of Honorable Prime Minister and other cabinet ministers, that we need to have a weekly kind of a target to ensure that we are able to reach the necessary medical supplies to the patients. So, for example, we need to improve the logistics of oxygen supply to the states and to the hospitals in the short term so that the turnaround time of the tankers is reduced. So for that, our Cabinet Secretary and Honorable Prime Minister permitted us to use the Indian Air Force. So we are now transporting the empty tankers on Air Force and bringing them back in full on railways. So the short-term target has been to improve the logistics of oxygen transport and also not to waste any oxygen.
India has administered over 17 crore 52 lakh COVID vaccine doses to the beneficiaries so far. The Health and Family Welfare Ministry has said that over 24 lakh 46,000 vaccine doses were administered to the beneficiaries within 24 hours. As the third phase of the vaccination drive is gaining momentum in the country, people are coming forward for vaccination.
Union Health Minister Dr. Harshvardhan today held a meeting with health ministers of 7 states and 1 union territory and reviewed the progress of the COVID-19 vaccination drive. These states included Uttarakhand, Haryana, Punjab, Bihar, Jharkhand, Odisha and Telangana, along with the union territory of Jammu and Kashmir. During the meeting, he discussed the steps to accelerate the vaccination drive. Speaking on the occasion, Dr. Harshvardhan said the country has administered more than 17 crore 52 lakh COVID vaccine doses to the beneficiaries so far. He asked states and union territories to ensure that all beneficiaries who have already taken the first dose are prioritized for the second doses. Dr. Harshvardhan urged states and union territories to ensure that the healthcare workers and frontline workers are fully vaccinated. The minister said the government is supporting the companies to ramp up the production of the vaccine in the country.
बिहार, हरियाणा, झारखंड, उत्तराखंड, जम्मू एंड कश्मीर, उड़ीसा, पंजाब और तेलंगाना यहाँ के स्वास्थ्य मंत्रियों से हमने मौजूदा कोविड की परिस्थिति है उसके संदर्भ में चर्चा करने के लिए ये मीटिंग बुलाई है। हर प्रकार के दबाव के बावजूद भी आप सबने बहुत संयम से, धैर्य से और पूरे करेज और डिटर्मिनेशन के साथ जनता के हित में कोविड के खिलाफ लड़ाई को जितनी तेजी से कोविड ने प्रहार करने का कोशिश किया उससे भी ज्यादा तेजी से आप सबने मिलकर कोविड के खिलाफ जंग को तेज करने का प्रयास किया है।
The Bharatiya Janata Party today lashed out at Congress and Aam Aadmi Party for building false narratives on vaccine supply. Virtually briefing media in New Delhi today, party spokesman Sambit Patra said, Congress and AAP are constantly trying to create confusion about the vaccine. He said, till yesterday around 6.63 crore vaccines were sent outside India. Mr. Patra said, vaccines have been sent in 2 categories. He said only 1 crore vaccines have been sent as aids and grants. The spokesman said rest 5 crore vaccines have been sent in the form of liability.
Amid the second wave of COVID-19 pandemic, India is registering declining trends in the number of active COVID cases. However, several states and union territories are still registering a high number of cases. The Health and Family Welfare Ministry today said that the active cases comprise 15.86% of the cumulative positive cases. It said there are over 37 lakh active cases in the country at present. As the country is registering over 3 lakh recoveries daily from the past many days, the recovery rate has further improved to 83.04%. The Health Ministry has said over 3,55,000 patients have recovered from this infectious disease within 24 hours. So far, over 1 crore 93 lakh patients have already recovered from this disease.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. PM CARES Fund accords sanction for procurement of 150,000 units of Oxycare system developed by DRDO at a cost of over 322 crore rupees. Union Cabinet approves production-linked incentive scheme for advanced chemistry cell battery storage with an outlay of 18,100 crore rupees. Government says swift clearance and apportioning of global aid by centre strengthen tertiary medical care across states and union territories for COVID management. Union Health Minister holds meeting with health ministers of 7 states and 1 union territory to review progress of COVID-19 vaccination drive. India continues to register declining trends in number of active COVID cases. Recovery rate improves to 83.04%. Over 17 crore 52 lakh doses of COVID vaccine administered in the country so far. Central Board of Direct Taxes issues refunds of over 17,061 crore rupees to more than 13 lakh taxpayers between 1st of April to 10th of May this year. Government says nearly 34 lakh 57,000 farmers benefited from ongoing Rabi marketing season procurement operations with MSP value of over 67 lakh 499 crore rupees. Israel-Palestine conflict escalates. Death toll rises to over 50, including 1 Indian. And Indian Meteorological Department says cyclonic storm expected in Arabian Sea on the 16th of May. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
A team of World Health Organization (WHO) India today visited the 500-bedded Sardar Patel COVID Care Centre at Chhatarpur, New Delhi. The team praised the ITBP team of doctors, paramedics and stress counsellors and doctors from other Central Armed Police Forces for the well-placed mechanism for the COVID care management at the facility. A total of 13,287 new confirmed cases of coronavirus infection were reported in the national capital during the last 24 hours, taking the total number of cases to over 13,61,000. Delhi government said over 12,58,000 people infected with coronavirus have been cured so far.
In Uttar Pradesh, a significant decline in the spread of COVID infection is being registered throughout the state. After more than a month, the number of newly infected patients in a day has come down below 20,000. New cases in any major cities are also on the decline. More from our correspondent.
As per the data released by government, around 18,000 new COVID patients have been found in the state in last 24 hours, while more than 26,000 patients have recovered. Situation is improving in major cities like Lucknow, Varanasi, Ghaziabad and Kanpur. In state capital Lucknow, after more than 40 days, the number of new infected patients came below 1,000, while more than 3,100 patients recovered in this period. Recovery rate has increased to 85.7%, while positivity rate is around 3.6%. Meanwhile, the state government is continuously conducting surveys in the villages of a state to identify the symptomatic patients of COVID infection. More than 4 lakh such patients have been identified and their tests conducted. Sushil Chandra Tiwari, AIR News, Lucknow.
Union Minister Dharmendra Pradhan has said that the next 15 days are crucial for the control and containment of the surge of COVID-19, especially in Odisha. Speaking to Odisha Chief Minister Naveen Patnaik on COVID management in the state today, the Union Minister said that Prime Minister Narendra Modi will further bolster Odisha's response to the current and emerging challenges of COVID-19. More on this report.
Suggesting to the Odisha Chief Minister Mr. Patnaik, Union Minister Mr. Pradhan said that the Odisha government should involve members of the civil society as volunteers and watchdogs to strengthen the relief and containment measures at the grassroots level. He also suggested to the Chief Minister to constitute COVID crisis management committees at the village and ward level comprising members from all political parties in Odisha to synergize efforts for effective management of COVID-19.
In West Bengal, with new and active COVID cases constantly on the rise, the State Health Department has issued new guidelines regarding adherence of oxygen therapy protocol. Our correspondent has filed this report.
As the demand for oxygen rises due to upsurge in COVID cases, the State Health Department reviewed and issued a guideline to ensure proper utilization of the same. It stated that the general tendency of overuse of oxygen leads to artificial crises and stressed upon the meticulous monitoring of oxygen therapy. It instructed the doctors to mention the appropriate device and initial oxygen flow rate in the prescription and the on-duty nursing staff to monitor the saturation level. The state government also started building oxygen plants in hospitals across districts to cope up with the situation. Madhuparna Chaudhary, AIR News, Kolkata.
Tamil Nadu government has decided to purchase COVID vaccines through global tender. Chief Minister M.K. Stalin today released a statement emphasizing the need to purchase more vaccines for people aged from 18 to 45 years. The government has also called for an all-party meeting to discuss the COVID situation tomorrow evening. Here's more from our correspondent.
Considering the increase in number of COVID cases and the urgent need for vaccination within a limited period of time, Chief Minister Stalin has said that vaccines would be purchased through global tender. He told that the centre's allocation of 13 lakh vaccines will not be able to meet the demand. He also appealed for an increase in the allocation of oxygen to the states. The Chief Minister also instructed the ministers of his cabinet to look into ways and methods of manufacturing oxygen and also to distribute oxygen coming from other states meticulously to the much needed hospitals in the districts. Joy, AIR News, Chennai.
Assam Chief Minister Himanta Biswa Sarma has issued an order to his cabinet colleagues to visit various districts to assess the COVID situation. The Chief Minister will visit Majuli district while Panchayat and Rural Development Minister Ranjit Kumar Das will monitor situation at Barpeta, Bajali and Bongaigaon districts. Forest Minister Parimal Suklabaidya will go to the Barak Valley. The ministers will assess the adequacy of healthcare facilities, check implementation of COVID-related restrictions and also guide and support the district administration.
Minister of State in the Prime Minister's office, Dr. Jitendra Singh, today convened a high-level meeting with senior officers of the Union Territory of Jammu and Kashmir regarding the COVID-19 situation. The Union Minister called for audit of ventilators and oxygen, regular issue of bulletin updating about the status of COVID management and keeping the people's representatives informed about what is being done to tackle the pandemic. Dr. Singh stressed the need for engaging the services of postgraduate or undergraduate medical students and retired doctors and paramedics. Dr. Singh gave suggestions to respective departments for controlling COVID situation in Jammu and Kashmir and assured all possible help and assistance from the central government. Chief of Army Staff General Manoj Narwane today visited some forward areas including Akhnur, Rajouri and Naushera. The Army Chief, who arrived yesterday at the White Knight Corps headquarters accompanied by Northern Army Commander Lieutenant General Y.K. Joshi, was briefed by General Officer Commanding of White Knight Corps Limited, General Suchendra Kumar, regarding the prevailing security situation, operational preparedness, COVID-19 management and the assistance provided to the veterans and the people of the region in the fight against the pandemic. General Narwane interacted with troops and appreciated their sustained efforts of all ranks towards maintaining the sanctity of the line of control as well as wholeheartedly assisting the civil administration, the veterans and civil population, especially in the border areas, to combat the spread of COVID-19 pandemic.
In the Union Territory of Jammu and Kashmir, the healthcare and frontline workers are tirelessly and selflessly rendering their every possible assistance to the destitute and the people in distress during the coronavirus pandemic. The nursing staff working in various hospitals across Jammu and Kashmir have been providing every help to the COVID patients and have set examples of their services to the whole humanity. More in this report.
The nursing staff as healthcare workers are religiously performing their duties in various hospitals. On the occasion of International Nurses Day today, such soldiers need to be highlighted who work tirelessly and selflessly to take care of others. One such example in Jammu and Kashmir is Mamta Sharma, a senior staff nurse working at MCH Hospital Gandhinagar in Jammu city. Despite helping mothers deliver 45 babies in the past 3 weeks, she has not been able to hug her own children since COVID-19 pandemic.
Commerce and Industry Minister Piyush Goyal today said that India feels much more comfortable in launching negotiations for a balanced, ambitious, comprehensive and mutually beneficial agreement on trade and investment protection. Speaking at World Economic Forum's Global Trade Outlook session, Mr. Goyal said that the country is looking forward to the trade and investment negotiations and the potential they hold for economic growth and prosperity for the people of India, UK and the countries of the European Union.
The Central Board of Direct Taxes has issued refunds of over 17,061 crore rupees to more than 13 lakh taxpayers between the 1st of April and the 10th of May this year. The income tax refunds of 5,575 crore rupees has also been issued in over 12,71,000 cases, and corporate tax refunds of 11,486 crore rupees has been issued in 29,592 cases. The government has said that procurement of wheat in the ongoing Rabi marketing season 2021-22 is continuing smoothly in the procuring states and union territories. The states and union territories include Punjab, Haryana, Uttar Pradesh, Madhya Pradesh, Rajasthan, Delhi, Gujarat, Jammu and Kashmir and Bihar. Ministry of Consumer Affairs, Food and Public Distribution in a statement said that till now a quantity of over 341.77 lakh metric tons of wheat has been procured against the last year corresponding purchase of 252.51 lakh metric tons. The ministry said nearly 34,57,000 farmers have already been benefited from the ongoing Rabi marketing season procurement operations with MSP value of over 67,499 crore rupees. The ministry also said that paddy procurement in the ongoing Kharif season 2020-21 is continuing smoothly in the procuring states. It added that so far over 733 lakh metric tons of paddy against the last year's corresponding purchase of over 681 lakh metric tons.
The centre has issued an advisory to states and union territories to provide tap water connections on priority to the remaining few households in those villages with more than 90% coverage of household tap water connections. Jal Shakti Ministry said, as reported by states and UTs, there are more than 21,000 villages in the country where remaining 10% households are yet to be provided with household tap water supply. The deadly exchange of fire between Palestinian militants in the Gaza Strip and the Israeli military has escalated significantly. At least 43 Palestinians and 6 Israelis have been killed since Monday. An Indian woman was also killed in a rocket attack in the Israeli city of Ashkelon yesterday. She was identified as Soumya, a native of Kanyaguli Panchayat in Kerala's Idukki district.
Indian Information Service Officer Dayavanti Srivastav passed away due to COVID complications. She was posted at Press Information Bureau in New Delhi. Born in 1965, she joined government service in 1991. She worked in different media units of the Information and Broadcasting Ministry. The Indian Meteorological Department has said that a cyclonic storm is expected in the Arabian Sea on the 16th of May. In a tweet, IMD Mumbai has said that a low-pressure area is very likely to form over the southeast Arabian Sea around 14th of May.
Now let us take a look at the weather forecast for tomorrow. The national capital Delhi is likely to have thunderstorms with rain. Mumbai will have a partly cloudy sky. The minimum temperature will be 26 degrees Celsius while the maximum is expected to be around 35 degrees. Chennai is expected to have a partly cloudy sky. Kolkata will have rain or thunder showers with strong gusty winds. Srinagar will have thunderstorm with rain. Temperature will hover between 12 and 20 degrees Celsius.
And now, before we end the bulletin, the headlines once again. PM CARES Fund accords sanction for procurement of 150,000 units of OxyCare system developed by DRDO at a cost of over 322 crore rupees. Union Cabinet approves production-linked incentive scheme for advanced chemistry cell battery storage with an outlay of 18,100 crore rupees. The government says swift clearance and apportioning of global aid by centres strengthen tertiary medical care across states and union territories for COVID management. Union Health Minister holds meeting with health ministers of 7 states and 1 union territory to review the progress of COVID-19 vaccination drive. India continues to register declining trends in number of active COVID cases. Recovery rate improves to 83.04%. Over 17 crore 52 lakh doses of COVID vaccine administered in the country so far. Central Board of Direct Taxes issues refunds of over 17,061 crore rupees to more than 13 lakh taxpayers between the 1st of April and 10th of May this year. And that is the end of this news bulletin. Good night.